Health Principle Secretary Susan Mochache says at no time did the Ministry of Health coerce the Kenya Medical Supplies Authority to favour certain suppliers. Mochache says contrary to claims made by KEMSA, the authority did in fact overspend beyond the 758 million shillings advised by the ministry in the purchase of medical supplies meant to combat the COVID-19 pandemic. Susan Mochache has moved to clear her name in the ongoing probe on alleged misappropriation of public funds at the Kenya Medical Supplies Authority. Mochache had been accused by KEMSA of directing tendering processes at the authority in an alleged scandal that continues to give COVID-19 management in the country a bad image.
Whereas there was an impression that had been created that the ministry had given KEMSA the list of the suppliers, it is actually them, KEMSA, who had provided the details while submitting the rationalized budget.
Mochache accused KEMSA of bypassing the Ministry of Health in requesting Treasury to help the authority offset budgetary deficits, despite clear directions from the ministry that KEMSA must limit its spending to the 758 million shillings made available for the purchase of medical supplies.
Chair, in my earlier letter you have seen I've only given them concurrence on the 758 million. And I also raised the concern that has been raised by my colleague that communications going to the Treasury must go through the accounting officer of the Ministry of Health, which in this case had been bypassed.
Health Cabinet Secretary Mutahi Kagwe told MPs that no item has been physically stolen at KEMSA, though the authority is said to accrue some operational losses due to the procurement of some hard-to-sell medical supplies.
The money lost, as you coined it, is a loss, is an operational loss based on the drop in prices. In other words, there is no money that is lost as in there is money that did not buy anything. There is no money that did not buy anything. All the money that was spent on buying PPEs, on buying equipment, on buying commodities, on buying ventilators, all those things are in the warehouses of KEMSA.
The Minister of Transport, which had also been invited to explain its handling of donations made by Chinese businessman Jack Ma, was sent away by the MPs for failing to provide adequate responses to queries made by the lawmakers. MPs say they have reason to believe that funds have been lost at KEMSA and medical supplies meant for the fight against COVID-19 may have been stolen through some skewed tendering processes.